Hello, everybody. Hello, everybody. I'm sorry to interrupt your lunch, but we're going to get started with some of our programming here today. My name is Anne Huey. I'm the generations reporter at the Globe and Mail. I write about generational shifts, generational divides, differences, basically the question of why is it that everybody, depending on generation, seems to be experiencing this world in very different ways. Before we get started, I'd like to acknowledge that the Globe and Mail's headquarters is situated on the traditional territory, the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. We are grateful for the opportunity to live and work on this land. And I would like to welcome both those who are in the room with us here today, as well as those who are joining virtually for today's event. Sleep, mental health, exercise, and diet can all play an essential role in not only the length of our lives, but also the quality of our years. But there are also things that are outside of our individual control, the socioeconomic determinants like housing and income, which play a pivotal role in population health. And there are also the added challenges. We're all pressed for time, and taking preventative healthcare steps can be challenging given that our healthcare resources are predominantly allocated towards treating illness as opposed to preventing it. So today's event will be looking at the demographic trends that are impacting the health of people living in Canada, as well as what healthy habits we can build that lend to a longer, healthier life. On behalf of the Globe and Mail, I'd like to recognize Manulife for sponsoring today's event. And on that note now, I would like to welcome Karen Cutler from Manulife to the stage.
Good afternoon, everyone, and thank you, Anne, for that wonderful setup. It's a true pleasure to be here today, and I'm looking forward to an afternoon of learning about a topic that is close to my heart. As Chief Underwriter for Manulife Individual Insurance, I oversee mortality and morbidity management. Cheerful topics, right? Anyway. My team analyzes trends in aggregate claims data. What we see is pretty fascinating, and especially over the last few years. This gives us a unique frontline view into the overarching health concerns faced by most Canadians. We do this against a backdrop of some pretty sobering facts. You may know that half of Canadians are living with at least one chronic illness, and the numbers are rising. By 2040, experts predict 1/4 of Ontario's population will be living with a serious disease, up from 19% in 2020. You may have read about this in the Globe not too long ago. And there are more deaths at younger ages resulting from largely preventable chronic conditions, such as obesity, diabetes, and high blood pressure. There's a paradox at play. Canadians in general may be living longer, but we're getting sicker. Believe it or not, my job gives me a lot of hope. This is because my team is also involved in research and development focused on emerging trends and in medicine and technology that push the boundaries of what's possible in helping people live healthier, longer, better lives. We also consult regularly with top medical experts, including those from the Cleveland Clinic, which is our medical director, CAMH, and the St. Mary's Prevent Clinic. Moreover, our experts tell us time and again that preventative health does not have to feel like a chore or a burden. All right, did we change slides? Okay. Sorry, I'm going backwards. Hopefully you're seeing the right slide. Anyway, it's supposed to be my puppy. Sorry? You got it? Okay. Oh, there he is. Okay, he came up. Okay, there we go. Thank you. So this is one way I make sure, and I make sure my husband walks a few times a day, even if it's just for a short spin around the block, which is really not because he's a puppy and there's nothing short about those spins. It all starts with adopting small healthy habits and turning them into consistent long-term behaviors that can influence positive health outcomes. These insights are the driving force behind so much of our product innovation at Manulife. We want to help Canadians feel more in control of their health. Now, there are many paths towards a healthier future, but in my view, they all start with a simple mindset shift. Quick show of hands, how many people here have a plan for your financial future? Yay. Okay. Maybe you're saving for a house or planning for retirement or making an investment decision. I'm sure it's one of those things, but most of us are familiar with the idea of investing in our financial futures. We understand that small contributions now can add up to big returns down the line. What if we were to adapt that same mentality to our health? Imagine if we started thinking about each workout, each earlier bedtime, or each nutritious snack as an investment in our longevity. Imagine we treated each healthy choice as a contribution to our health span, the duration we're able to enjoy a high quality of life. Imagine we plotted out what we want the last 10 years of our lives to look like and treated them as our ROI. Makes it a bit easier to put the sneakers on, doesn't it? We always say you just need a good pair of shoes. Now, we know no preventative act is a silver bullet, but small behavior changes can up the odds that every day we have as healthy a life and are as prosperous as possible. As we settle into this afternoon's programming, I challenge you to ask yourself some questions. If you're a business leader, how can you take what you're learning here today to better support employee health? That's a big concern for a lot of people. If you're someone who helps others plan for their future, what kind of conversations do you need to be having to help pave the way to a longer life for your clients? And for everyone, what do you want your future to look like? And what can you take from today to get there? Thank you very much, and I hope you enjoy the afternoon.
Thank you very much, Karen. Today's first discussion is focused on the current demographic trends shaping longevity and health in Canada. Our next two speakers will be sharing their insights, so please join me in welcoming Laura Rosella. She's a professor with the Dalla Lana School of Public Health at the University of Toronto, and Dr. Steve Pomedley, physician with Cleveland Clinic Canada. So thank you both for joining us. To get started, maybe we'll just work from the far side of the stage, and you can each introduce yourselves a little bit more beyond that very brief bio that I gave, and just kind of give us a sense of where you fall in this discussion that we're having today.
Awesome. Well, thanks for the invitation, and great to be here today. So I'm Steve Pomedley. I'm a family doctor, primary care physician here in Toronto. I've worked in a number of different primary care models over the years and been in practice for a little over a decade. And I see patients from birth to end of life. And I also do some work with local and provincial health systems. And with Cleveland Clinic's corporate advisory team, I'm part of the medical director team for Manulife's group benefits team. So excited to be here and talk from that perspective. I might give a little pitch for primary care in the context of longevity, because we maybe don't sell it in quite the way, or maybe we don't market it that way, but a lot of what we do in primary care is essentially longevity. We don't have maybe the TikToks or the other folks that are really pushing our brand, but so much of what we do, focus on things like longitudinal health and well-being, having ongoing perspective of someone's needs throughout different ages, understanding the comprehensive needs from their physical, mental health, and social well-being, and thinking about what people really need from a preventative and health promotion perspective. And all of this is really, focused on the key things I think we're talking about today, which is how do you encourage people to have a long, healthy, and fulfilling life? So that's kind of the perspective I want to bring today. And then just briefly about, how we think about kind of ages. I think we got a really unique perspective as we watch people, grow, age, mature, get older. We see really how, different things affect people at different stages, and what are those moments for intervention, what are those moments that we can really make a difference in someone's life. And we can also see how those cohorts of our patients kind of change year to year, but also different cohorts are experiencing different challenges. So all these things can impact health and longevity in different ways. So that's kind of my pitch about primary care and longevity, and hopefully we can talk a bit more about some of those themes today. But again, thanks for inviting us.
Yeah, we'll definitely be talking about those TikToks later.
Sounds
Laura,
great.
did you want to introduce yourself a bit?
Yeah, absolutely. So I'm Laura Rosella. I'm a professor of epidemiology That means I look at large linked databases and study trends in population health in great detail. I have a particular focus on studying mortality trends and how mortality has changed in Canada, in Ontario, and even locally, and I'll talk a little bit about that. And I also do some modeling work about what's to come. So unfortunately, some of those numbers you just heard in the introduction with some of the work that we do where we can take this information and project what's likely to happen in our population. So focusing on the data, focusing on the trend, understanding what influences life expectancy in our population.
Okay, so let's get a lay of the land, and since you've referenced the data and the demographics, the trends, maybe Laura, it makes sense then for you to take this up. Can you explain to us what is the demographic picture that we're seeing here in Canada, and what does it mean for this idea of longevity?
Yeah, so first, from a demographic perspective, you might all remember from school those sort of population pyramids where it shows how many people are in every age group. So in Canada, it's sort of going towards a pillar. We're seeing large population growth, but the largest population growth is happening in those 65 and older. So that has tremendous implications for health and all aspects of society. From a life expectancy perspective, we're living longer than we ever have on average. So in Canada, life expectancy is around 82, 85 for women, 80 for men. But we're living more of those years in ill health. One of the studies we did found that by the time you die, most Canadians live with 5 or more chronic conditions. So these are things like diabetes, cancer, dementia, heart disease, etc. So the norm is to die with multimorbidity, multiple complex conditions, and we're spending more of those years in that space than we ever have in society, and especially in Canada. The other thing I'll mention, actually, that some people don't know is that I said we've been living longer than we ever have before, but actually life expectancy gains. So pretty much since we've been tracking this, we've been gaining years to life expectancy in Canada. From 2019 to 2022, they've actually slowed. So that's the first time in history that we've had 3 consecutive years of slowing life expectancy. And that's really alarming. If those of you that study life expectancy know that very rarely happens. So even though we're living longer on average, yes, we're spending more years in ill health, and we're actually starting to see even the living longer part starting to slow down.
And Steve, do you want to add to that? I know you've pointed to some concerning things that you've seen in your own practice with younger groups as well.
For sure, and I might underscore too a lot of what Laura's spoken about too. We see a lot, so certainly metabolic trends are some things that we see that are very concerning. So we know that in the last several decades, like obesity rates have tripled for children as well as adults, which is pretty alarming. And we know that's going to drive so many trends going into the future as major risk factor for things like diabetes, which has continued to increase across many age groups, including adolescents, 20 to 30-year-olds as well, which is always an alarming thing, knowing that these metabolic risk factors are accumulating at earlier ages, which not only impacts them then, but we know impacts them for a large portion of their life going forward. So that's always alarming for sure. As part of this, we also, what we see in clinic also reflects some of the, concerning stats where we see that about 80% of Canadian adults, so 4 in 5 of us, have at least one major risk factor for chronic condition. So being one of smoking, unhealthy alcohol use, sedentary lifestyle, and unhealthy diets. So that's really setting us up for not maybe the success we're looking for in terms of longevity. So those are some alarming things that really play out in terms of what we see in clinic. Also, what you're mentioning in terms of younger groups, I think we're seeing a lot of stress and mental health concerns at younger ages, which is also alarming. So we see this starting in the teenage years and going well into the 20s, and a lot of this is driven by quite a number of compounded stressors, but it's something that's definitely shown up a lot more. And I'd say kind of maybe a positive element of that is we are seeing kind of more acceptance and interest in seeking help in those groups, which is great. But still we're seeing overall rates of things like anxiety and diagnosable conditions like depression really ramping up. So that's definitely something worrisome that we need to think about more holistically, because we know that is part of quality of life in terms of mental health and also impacts longevity.
So thank you, both of you, for that. Can we just stop and talk about the word longevity for a moment while we're up here? you don't need me to tell you that that's a word that's very popular right now. It's kind of a buzzy term. To me, in a lot of ways, it feels kind of like a rebrand of other words that we've used before: healthy living, whatever else you want to talk about, wellness. What does longevity mean to you? What are some of the misconceptions that you think are out there around longevity? What are you both talking about here when we're talking about longevity?
Yeah, I'll say the first misconception is that longevity is about living as long as you can and not necessarily living as many years as you can in healthy life without major illness. And that's sort of the health span versus lifespan discussion that's coming up quite a bit. And I think if our focus is just adding, years to life, then you can see why we've done things the way we have. We've been focusing on those technologies that really extend life at the end versus thinking about how we actually live a healthy life as long as possible. The second thing is, I think, we can pat ourselves on the back and say, great, life expectancy has increased in Canada, or this country has the highest. Another thing that's behind that data is that we have some of the biggest variation we've ever seen in society in terms of who's living that long and then who's not living that long. And those gaps are widening. They've been widening considerably in Canada since 2008. And they're the widest they've ever been. So that also causes a lot of issues. Again, if we're just focusing on the average life expectancy, we're missing a lot of issues there. And then the last thing I'll say is that medical technology or advances in medicine alone will not be enough to extend longevity if that's our goal. I want to be very clear, it's very important. We can't stop medical advances. We need high quality healthcare when you need it. But if we're only focused on that, we won't achieve longevity.
And just to unpack some of what you just said, so when you were talking about that gap widening, can you just spell it out explicitly for those of us in the room who aren't following this stuff day in, day out?
Absolutely. So, those living in the lowest income neighborhoods die prematurely about 2 or 3 times higher than those living in the most highest socioeconomic areas. We also know that there are specific subpopulations that are highly affected by particular ailments of society, and that disadvantage is showing very clearly in the data. And one of the reasons 2008 is when the inequity started widening is we had a recession. So when we're in economically turbulent times, all of a sudden we see that premature mortality really skyrocketing among those individuals.
Okay. Did you want to add on the subject of longevity?
Yeah, for sure. And I think, broadly, I think we all can kind of understand longevity is very intuitive and appealing, right? I mean, it's hard to argue and say that I'm not interested in both a longer health span and lifespan, right? I think most people struggle with that, saying that I'm not interested in longevity, right? So that I think it's very compelling for everyone to be chasing this. But I think what I see in clinic is this can also mean very different things for people, right? So everyone has a different idea about what quality of life means, what's a meaningful life, what's fulfilling. Sometimes there's even a sense of control that's important. I want to lead a life as I want to live it, and how do I, even have an end in palliative care that's, on my terms. And so there's these interesting nuances that aren't always just captured by some of the data. And I know there's a lot of economic efforts to try to understand, things like quality of life and include that in some of our modeling. But sometimes there's a lot of very personal nuances that really impact what we think about for longevity. And I'm sure in our minds we all have ideas about where we want to be in the next several years, and maybe at end of life where we want to be. So sometimes there's a bit more human element too that I see when I'm having these discussions with patients. I think in terms of kind of misconceptions as well, I think there's a lot of thoughts about that there's some magic bullet or some secret out there, right? And a lot of what I do is kind of sometimes dispelling or demystifying longevity as we think about it here, and talking to folks about some of the really simple and boring things that are actually really important and really effective. Most of the research shows that probably about 75% of the contributions to longevity are things that happen to our bodies or we do to our bodies on a kind of day-to-day basis. And so those are sometimes things we control, many times not, but often are things that we think as more proximate. So those are really key things that we need to keep in mind when we're thinking about how do I get somewhere where I want to be in terms of my health and in terms of healthy years going forward. So often think about that, kind of dispelling that myth.
And what are those 2 or 3 very key things?
Yeah.
Just because we should probably,
Sure.
yeah, we
I
should
could-
probably
yeah.
talk about that.
I think there's some other folks. I don't want to steal all the thunder, but I think there's probably a set of 6 or 7 key things that often are cited. So we know certainly things I mentioned before. So reducing smoking, minimizing alcohol use, healthy activity levels, sleeping well, restorative sleep, stress management, good nutrition, and then maintaining good positive social connections, and then also maintaining mental health. Sounds sort of easy, not really, but there are a lot of kind of things that I think resonate with many of us, and things that maybe we think we're doing well on, and I'm sure many of us have that mental checklist, and maybe there's a few things we can continue to work on. But those are really key things. And again, it's sometimes simplifying and picking off the ones that really seem attainable or approachable for someone in the kind of context and the milieu of their current lives.
You say that they're kind of not obvious, but they're kind of straightforward things. But I think that those pieces of advice that you just gave do tend to get lost in the discussion, especially when we talk about, as you mentioned, the TikToks and the kind of cultural phenomenon, I think it's fair to say, that longevity has become in recent years. So I'm sure you all have seen, and probably many of you in this room as well, the popularity of this idea of longevity via social media. So we have the longevity kind of influencers, people like Peter Attia, Andrew Huberman. They're kind of huge figures in this longevity space. There's a lot of talk in those worlds about technological innovations and technological interventions potentially. How far do these kinds of tech interventions take us? So I'm talking about things like cold plunges. I'm talking about red light therapy, 88 supplements a day. What else? There are so many of them. There's the sunlight bathing. It's a long, long list. And if you've seen that video of the 4 a.m. influencer who wakes up and goes out and does like 100 push-ups on his deck in the pitch dark, you know exactly what I'm talking about. So what do you make of all of this? Where does it come from? How much kind of real medical science is behind it? What is this? What is this?
Yeah, good question. So first on the how much do these innovations actually contribute? This is a very good question that scholars have debated this time and time again. And it looks like definitely no more than 25% of our gains in longevity are due to sort of these technological interventions. And I'm being generous, the most cited number is about 10 to 15%. So again, very, very important. We want those gains to continue. We want the next generation drugs and treatments and high quality healthcare. But if we're really talking about moving the needle, it's much more than these types of things. The second thing I'll say is about evidence. So this is really, it's like a touchy topic for me, for sure, in particular, as someone that just like dedicates my career to generating high quality, rigorous evidence to inform health decisions. And unfortunately, we've reached an age where there is more misinformation and disinformation in health evidence than we've ever had. And it's getting worse by the day. And it's, I don't actually mind influencers that are able to communicate a positive health promotion message in a way that maybe their physician can't or their parents can't. That's not a problem, but where's the credibility behind that information? And it's actually becoming a crisis in and of itself, is, public trust in science. And I'm really, really worried about that, actually, because not only is it not going to contribute to longevity or even just move the needle, but we're actually going to start to break down some of the things we know with strong evidence actually do contribute to positive health.
Did you want to add to that?
Sure, absolutely. Yeah, I totally agree with that. And I think what we see is, there's almost this stream of information, and it's hard to distinguish what's real, what's not, what's helpful, what applies to you, what doesn't. And I think what I see as part of that is for many folks who come to clinic and we have these discussions, there's a lot of lack of confidence. People say, but I heard this, what about this? You told me this, I thought this was a good thing, this seems to make sense for me. And so people are kind of questioning themselves, their strategies, their approaches, they're trying to understand what they should prioritize. And it's really hard to disentangle that. And not to say we are always the person that can help navigate that, but it sometimes creates some paralysis and can be uncertain as to, what's going to be most important, how do people prioritize, and how do they find what's actually going to be meaningful and important to them and actually make sense. And so those are a lot of the conversations we're having. In some ways, to the point about, it's not all bad out there. Absolutely. I think it's sometimes empowering for people to find really important information or have other people answer really good questions. And so that can be valuable, but I think it's the volume, and we know that there's a lot of problematic information out there too that makes it really hard for people to navigate.
And I think that this discussion right now gets at a bigger question that I wanted to put to you both, and I know you've both talked about this in the past, is this tension between what we can do for ourselves as individuals in pursuit of good health, in pursuit of longevity, and at the extreme end of that, I think about these people who I've met who do, private MRIs, individual MRIs. They pay out of pocket every year to, do body scans. They do, they pay out of pocket for regular blood testing. This very, very kind of, I shouldn't say extreme, but going to great lengths to try to pursue good health for the individual. And then the tension being that next to, public health, the health of all of us. So how do you kind of balance those two things? Maybe Laura, it makes sense to start with you.
Absolutely. I mean, it's definitely a tension, and we struggle with it. And again, I want to say individual empowerment's critical, high quality healthcare for individual treatments, and we're getting better at personalizing them, and they're getting much stronger. But we actually can't move the needle unless we actually think about the conditions in which people live. Like, they live their everyday life and all the things that touch that. And, making healthy choices easier, more accessible, those are the things that even a little bit have dramatic influences on life expectancy. And I would say that it's the balance that we get off. We focus a little bit too much on individual because we think that we can control it. And then the pressure to focus on the things that actually make our food supply, our environments, our early childhood education, which has a dramatic impact on life expectancy. I mean, your postal code predicts your life expectancy more than your genetic code, right? So they're both important, individual and population aspects, but we get the balance off and largely just forget actually about the public health influence.
I definitely agree, and I think part of it too is we, when I'm talking to an individual, we can focus on so many things and we can try to, have motivating discussions, but I know that as soon as someone leaves, the room, there's so many other things that are going to have major impacts on whether they can kind of achieve what they want, whether they can meet their health goals. And some of those might be, again, in closer control, or they feel they can influence some of it, but a lot of it isn't. And so that's really challenging. So we think about what is this broader milieu and how do we think more intentionally if we're really dedicated to this as a broader society, like what do we think drives longevity across the board? And so what are those big bets we need to make in terms of if we're really interested in, for example, changing the curve on metabolic health or mental health? Like what are those big things we need to think about more kind of holistically and across sectors? Because as Laura mentioned, it's things like our built environment, it's what we're returning to, it's our neighborhood, it's the walkability, it's all these kind of core things that can really impact how people engage in their day-to-day life. And so many of these things kind of shape our lives in ways that we don't even realize. And so sometimes when you have that ability to almost subconsciously or unconsciously live a healthy life, that's so powerful, and it takes off some of that cognitive load of being like, I also need to do this, I need to seek this out, I need to work hard to go across the current because I want to have this type of life that's healthier for me. And so if we put that on everyone individually, that's very challenging, but if we have a broader sense of this is how we want to support people going forward, that has really profound impacts.
Can you unpack, so you've just referenced a few examples of potential solutions or meaningful interventions that can apply to broad swaths of the population. You talked about, built environment, neighborhoods, that kind of thing. What are some other real, tangible potential solutions that we should be talking about that can move the needle at a broader kind of scale than the individual? Are there models elsewhere that we should be looking to? What are some potential solutions?
Yeah, I mean, I think when you look around the world, there are countries moving in the right direction, and when you look around the world, the common one is, they have a societal goal related to health. Like every sector of government is thinking about, we need a healthy, productive population. And so, in three countries that come to mind, so in Singapore, for example, they've totally focused their entire health strategy on being preventive, moving away from a reactive health system to a proactive health system. They're very, they have some of the most advanced digital technology around health in the world. They're thinking about urban design in creative ways. So it's a very technology driven, but every aspect of health promotion and prevention is part of the health society there, all of society. New Zealand totally revamped their health strategy to a well-being strategy. Again, this idea that we want to keep people well, and it affects social policies, health policies, integrated care. They don't focus on individual diseases because that doesn't really make sense, especially for prevention. And then Japan is very well known for having some of the longest life expectancy in the world, but a lot of people don't know that they actually have the longest health spans in the world. So they live as long as possible without diseases. And what I really like when I look at their strategies, it's all focused. There's a big focus on older adults, and it's about being productive, independent, and socially connected in older ages. So they have this huge focus on that part of aging well. And so again, all these different countries, what are they doing? They're actually saying, we want to be the healthiest jurisdiction. Health is our goal. And how do we line up all aspects from policy to healthcare to schools to actually point towards that direction?
You mentioned something really interesting just now, and that reminds me of a point that you've made earlier about measuring health span, basically. And when we first started this conversation, we talked about misconceptions around longevity, and you were saying one of the biggest misconceptions is just, living until 120 or 140, 160. You said it's not that. It's not just about the number of years. It's about measuring the portion of our life where we're living healthily. But how do you measure that? Because that seems like a part of the problem.
It is a part of the problem. I mean, we have to not just measure how many years people are living, but how they're living and what illnesses they're living with at different time points. And so there's this very old concept called compression of morbidity, with the idea that you want to compress, illnesses are going to come as we age, but it's not inevitable. Many are preventable, and many can be delayed by, say, 10 years. That makes a huge difference. Getting diagnosed at 65 versus 75, dramatic difference. So the idea is, can we compress that as long as possible? And we can do this now with the data capture that we have. We generally know what conditions people are developing and when they're developing them. So when we look at our mortality data, we have to look at it in the context of not just are they living, but are they living alone, independent, activities of daily living. And so these are the types of things that are being incorporated in a more contemporary way that we measure life expectancy.
And did you want to add anything on the question of solutions?
Yeah, and I might even look kind of domestically here too, because I think sometimes we look elsewhere, which is awesome, and I think there's so many good models out there and ways to be inspired by other health systems. But even looking back the last 50, 60 years, we can think about changes in smoking rates as being one thing that we really latched onto and decided as a country that we wanted to be very assertive about that, right? And so smoking rates went from 50% among adults, huge amount, in the 60s to where they are just in the kind of low teens or around 10%. And I'm sure many of us can kind of think back to the changes that happened, and it wasn't overnight, right? This is a kind of a 60-year project, but thinking about everything from, increasing the price through taxation, reducing advertising, having PSAs, having, clinicians talk about it, have other folks talk about it, changing our physical environment so that smoking is no longer allowed in the same areas, pushing it to the periphery. So all these kind of things that have to come into place over years. So this kind of layered, very intentional approach. And that's probably how we make some changes on some of these big grand challenges, right? We need to think very, very specifically and have this intention. And sometimes this is reflected in something called a health in all policies approach, right? Where when you're looking at any policy, there's kind of the intention that you assess it in terms of how it impacts health and how it impacts some of the determinants of health. So you're being very, very critical about policy development and also thinking about what exists in the policy sphere and how do you actually shape things so everything's moving in the same direction rather than, conflicting policies that perhaps have different impacts on some of the same health measures. So I think things like that can be very compelling frameworks to think about. And I think if we're really interested in these challenges, we need to think about that very purposefully as a society.
Are there other specific programs or like when you're talking about domestically and successful success that we've had here? Are there any specific programs that you're thinking of beyond the smoking, which was big for sure?
For sure. I think even, vaccines, we're always struggling with getting the rates maybe exactly where we want to be, but I think they've been a pretty good success story in Canada for the most part. And, really are something that sets someone up for life in terms of the childhood vaccines and then increasingly some interesting technologies that have emerged even in the last few years that are obviously there's the COVID vaccines, but new vaccines that have also come up for things like RSV that are also really important for children as well as older adults and everyone in between. So I think, continuing to have this push and thinking more broadly about how do we really attack some of these, really critical health problems is really going to do us all a service if we're thinking about, the broader approach across our society.
We have just a few minutes left. So before I wrap it up, I want to give either of you a chance to touch on anything else that I may have missed or anything else that you just desperately have to add before we get off stage. But before I do that, I think it's very, 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 very important that we go back to those like 4 or 5 pieces of basic but extremely important advice that you have for everybody here in this room and everybody out there on what to do for building longevity.
For sure. For sure. One thing I might also say, though, is if I want to have one other closing remark is I loved Karen's comments in the opening there about thinking about our investments in health and how we're kind of building this repository, this fund for our future health every time we're doing a daily action or improving our health with day-to-day habits. Sometimes I even like to extend that analogy a bit and think that it's not just something that's going to pay off well into the future, because sometimes that can be a little bit not always as motivating as we hope. And sometimes what we add on to that is, these little small investments that you're doing day to day can actually pay dividends on a daily basis too. So you're getting benefits back right away. So that's things like, sleep habits, again, healthy exercise levels. This actually makes you feel better sometimes the same day, the next week, that month. And so you actually get a lot of benefits in the short term. And so I usually try to articulate that with patients that you're not just trying to prevent diabetes in 20 years, but you're actually hoping to feel better this week and this month. And so I think that's something I like to just layer on there in terms of getting that dividend. So some of those key habits, here we go. So healthy exercise levels or activity levels, good nutrition, restorative sleep, thinking about stress management, good social connections, reducing alcohol and smoking, and maintaining your mental health. So those are the ones I'd usually think on. And then there's a lot at the margins, but those are kind of the key ones. And I'll pass it over to Laura maybe for the last remarks.
Yeah, and what I just wanted to jump off those and say, well, how as a society can we build our society and orient all our policies so those things aren't as hard as they're really hard to do, that list. I know, I'm speaking for myself personally, and everyone I know has trouble doing that. Why is that? It's not because many of us aren't motivated or we don't want to, but it's hard. There's many aspects of society that makes it very hard. So what can we do as a society to actually orient ourselves to make those things easier? And the payoffs at the population level will be tremendous. We're about to enter a very scary time in terms of our healthcare system not being able to keep up. It's already not keeping up with what's ahead of us if everything's going to grow. So how can we orient our population around that? Why isn't it our goal to be the healthiest population on the planet for Canada? That's what I want to see. And even I was trying to get our province to do that at some point. We should expect no less, because after health, everything else comes, including wealth, by the way. So I'll end it there.
Thank you so much to both of you for being here today, for your very smart insights. Thank you.
Thank you.
Thanks so much.
Martin Gabala is a professor of kinesiology and the Faculty of Science Research Chair in Integrative Exercise Physiology at McMaster University. Martin is widely known for his research on high-intensity interval training and wrote the best-selling book, The 1 Minute Workout. Today, he joins us to discuss how short, powerful bursts of exercise, also known as exercise snacks, can trigger big health and fitness gains. Please join me in welcoming Martin to the stage. Thank you.
Thank you. Well, thanks. Good afternoon, everyone. Thank you to Manulife and the Globe for putting this event on. Thanks for the organizational support to this point, and thank you for coming, whether you're in the room or watching online. That was a great setup. I think for one topic that I'll talk about today, I'd like to make the case for exercise, or at least brief, vigorous physical activity. I will show you some data, but try to put it in context. And I do that just to try and provide a sense of the evidence base that underlies what I'll be talking about today. So if you want to nod off in the next 20 minutes or so, these are the 3 key points that I would like to leave you with. And so the first, I'm going to make a case for fitness, for cardiorespiratory fitness. It's something that we should measure. We should think about it as a health vital sign, and it should be routinely assessed at least once a year or so. But there's different ways that we can do that, from simple to very, very complex. Number 2, I'm going to talk about vigorous physical activity. As was mentioned in the introduction, I do a lot of research around high-intensity interval training. That notion of high intensity is scary for a lot of people, or they think that's not for me. High-intensity training, that's for high-level athletes. I'm just talking about vigorous, intermittent physical activity. Vigorous is in the public health guidelines. It's something we should all be doing anyway. So when I'm going to use the term vigorous intermittent exercise, it's synonymous with high-intensity interval training. One's for athletes, one's for regular people, and some are both, of course. But I'd really like to make the point that many more people than we think can do this type of, or reach these types of intensities, and it doesn't mean an all-out sprint from danger pace. And really the main point of today's talk is this one, that brief bouts and surprisingly small amounts of vigorous physical activity embedded in your daily lives can really make a difference in terms of reducing health risks. I see a few people snapping their camera. That's great. I'm more than happy to share a PDF of my presentation with the organizers after, if that helps, and send it out to anyone who's interested. None of this is new. I work in the area of interval training. It's a topic that we rediscover every decade or so, but the notion that this can be beneficial for health is not new. In fact, the Canadian government was telling us this about 6 decades ago. Some may remember this plan. It was called the 5BX plan, which stood for 5 basic exercises. It was originally developed by the Canadian military, who hired one of the first exercise physiologists to try and get service members who were stationed in literally near the North Pole at the height of the Cold War. They were stuck in an area. They didn't have much equipment. They certainly didn't have much time, but their fitness was very poor. At one point, 1/3 of Canadian Air Force pilots were so out of shape they were deemed unfit for service. So the government developed this plan. It spread beyond the military, and this pamphlet was circulated. Over 20 million of those were printed to Canadian households, and the tagline was this, something that still resonates today, I think. People are time pressed. They don't necessarily have equipment. There's social barriers to fitness. It didn't take much time. It didn't take much space. It didn't take elaborate equipment, and it only took 11 minutes per day. So in some ways, everything old is new again, and these concepts keep coming back, these fundamental concepts. As mentioned, I'd like to make the case for fitness as a vital sign. This is a scientific statement put out a decade ago by the American Heart Association, very authoritative agency, that was really just making a simple point, and that's your longevity, your mortality risk, your risk of dying from all causes is very much related or associated to your fitness level. And so these are classic data from Stephen Blair, who was involved with the Cooper Clinic in Dallas, just showing the relationship between mortality and fitness. And you might say, well, isn't mortality 100% for all of us? Of course it is. What we're talking about here is risk of dying at any point in time. So over a year, what's your risk of dying, or how many people die in a given period? So what that's showing is in the dark bars are men, and the open bars are women, and on the bottom, going from left to right, is just fitness level. So people with the lowest fitness level clearly had the highest mortality risk. And just moving, what you want to do is get out of that low fitness zone. Just get out into the next level, because that has marked improvements in your health status. I'm going to focus here on longevity given the topic, but you could layer on health span and with almost anything I'm talking about. Where this, I think, hammers home for some people is when we put it in context to other things that we measure in the physician's office. So fitness, at least as strong a predictor as many factors: cigarette smoking, hypertension, high cholesterol, insulin resistance, type 2 diabetes. If I was to tell you the risk reduction that you can get by boosting your fitness 10% is the same as a 5-point drop in your blood pressure. So think about the medication that might be required to drop your systolic blood pressure by 5 points. You can do the same by boosting your fitness by about 10%, and you can easily do that in 6 or 8 weeks with brief, vigorous exercise. And so the point that they were making was that efforts to improve fitness should be a part of clinical encounters, which means we need to measure it. We need to somehow quantify what fitness is. So how do we do that? There's lots of different ways, but why fitness is so important is it's the clinical measure or clinical correlate of something that athletes talk about, or what I measure in my laboratory all the time, VO2 max. You may have heard that term. It's having a moment now, certainly with many fitness influencers. It's the highest amount of oxygen that your body can take up and utilize during heavy exercise. And it's a proxy marker for the underlying physiological capacity or health of so many systems. It's largely related to your heart, how much blood your heart can pump every minute, but it reflects the functioning of your lungs, your blood vessels, your muscles, the integrated capacity. So simply by measuring one thing at the mouth, relatively non-invasively, we can get a very good metric of the overall functioning of many different physiological systems. So if you come into my laboratory, I'm sure if you go to the Cleveland Clinic in Canada, other places, you can pay $150 and you get a test done like this, where we measure it very, very accurately and very directly. That's not accessible for a lot of people, but the gold standard to do this is, again, a direct measure. So it looks a bit like a cardiac stress test, but we have you go to maximum and you're breathing through a tube, and we're literally measuring the total amount of oxygen that your body is using during exercise. So again, gold standard, but it depends on the equipment, procedures, motivation of the individual to really reach maximum. It's not appealing for a lot of folks. So, what else can you do? There's indirect measures. So you can use your heart rate response. There's something known as the YMCA fitness test. If you're associated with a fitness center, they might do some sort of submaximal test on you on a bike or have you step on a bench, measure your heart rate, and try and get an estimate of what your fitness would be. And they're saying if you're a typical 40-year-old whose heart rate is this at this workload level, well, on average, then this is what your fitness might be. Certainly more convenient, but there's a lot of variability in maximal heart rate between individuals, and so that's going to affect the specific number that you might get. You might say, can't I do it from my app? You'll get a number, but the apps vary a lot in terms of the capacity of the algorithm to be accurate or not. If you don't want to exercise at all and still get a number, and again, I know I'm going to lose some people now. If you want to jump on your phone and go to Google World Fitness Level, you can. I'd ask you to maybe do it after the talk on the break, but it's going to ask you a series of questions, and you're going to get a number, and that number is pretty good because it's based on a lot of research that's been conducted in Norway looking at this. So if there's one non-exercise online calculator that I'm going to direct you to, it's that one. it's the most convenient, and it's going to give a risk estimate that's been validated in the scientific literature. So there's studies showing an association between estimated VO2 max using this calculator and mortality risk in large numbers of individuals, but it's going to be the least accurate. But that's okay. Any of these things will give you a marker in the ground, and then you know over time, am I trending positive, am I trending negative? I'm going to start this fitness program. I'm going to see if I can move the needle a little bit on my fitness level. But again, you need a marker. You need to know your fitness level. How much does it have to change for it to matter, right? So now we're having data around how much do we need to move the needle for it to have an impact on my health. And so again, I'm going to show you some data here because I want to show you the science that's behind much of what I'm talking about, but trying to put it in context for you. So now this is a study published a couple of years ago, large database, over 90,000 individuals across a very broad age range, 30 to 95 years. They had their VO2 max, or their fitness, measured directly using a treadmill test at least a year apart. And then they looked at risk of dying in these 90,000 individuals. And this is what they see. They divided the data into quartiles, or who is the least fit, who is the most fit. I'm showing the least fit here, but the data was the same. So it didn't matter where you started. If you were already highly fit to begin with, if you improved your fitness more, your risk for dying went lower. But if you were very, very unfit in this category, the relationship was very strong. And so what this is showing is people who didn't change at all, their number was set at 1. And this is a hazard ratio, so literally the risk of dying. So by improving it a little bit, you reduce your risk of dying by 10%. If you improved it more, you had a greater risk reduction. If you got less fit, which is what happens to all of us as we age inevitably, there's an inevitable age-related decline in fitness, your risk of dying goes up. And so what they showed, or the takeaway from this large study, was encouraging the public to improve their fitness by at least a MET can have considerable personal significance, clinical significance for you, but public health significance as well, given how much we spend in the healthcare system. So what's a MET? Again, I'm going to try and show you why for the average person, it's about a 10% boost in your fitness. So if we look at fitness levels across the board, what are the reference standards? And then again, we don't have these are not commonly known to people, or it's not something that's commonly discussed, in a 10-minute visit to the physician's office. They're very busy. They're worried about your blood pressure, your blood sugar, things like that. We certainly have metrics for what those numbers are. If your HbA1c is this, physician might recommend a drug for you. Boy, you're getting into the pre-diabetes range. We can start to have that for fitness as well. And so these are standards that have been derived from a large number of individuals, again, over a large age range. Forgive me, this is the most complex slide, but I'll just show you a couple of takeaways. What this is showing then is fitness as a function of age in men and women. What you can think about is those boxes in the middle is the variability around the average, right? So most of us are going to fall in those boxes in the middle somewhere, but those long lines and dots are the people on the far ends. And so on average, an average person has a VO2 max value of this, 35, right? As all of you are sitting here right now, your resting oxygen uptake is 3.5, or this concept of 1 MET, right? So as you're sitting here right now, the amount of oxygen that's taking you to stay alive and breathe is 1 MET. On average, if we measured everyone in the room, your peak capacity is 10. So that's the usable range for most individuals, about a 10 MET from rest to maximum. But you can see people in their 80s, there's some people in their 80s well above that. Some people in their 20s, very unfit. They're just above resting level. And so one of the levers that you can adjust to change that where you fall on that spectrum is physical activity. So, what should we be doing? What is the government telling us right now we should be doing in order to improve our health span, improve our longevity potential? As we've heard, it's complicated. It's not complicated, it's daunting for people, right? So these are the current guidelines, the current over 24 hours. What should we be doing every day? We should be reducing what we're doing right now, sitting in a room for 3 hours, right? But that's life, right? Reduce our sedentary behavior. Get good quality sleep. We're going to hear about that in the closing keynote. Be physically active. That's not just aerobic exercise. That's lifting weights or resistance exercise as well. I'm just focusing on this piece, right? What we're being advised to do from an aerobic physical activity level is about 2.5 hours a week, right? 150 minutes of moderate to vigorous physical activity every week to promote our health, broadly, physical, mental health, including enhancing our longevity potential. So what is, we hear this term all the time, moderate to vigorous physical activity. What does that really mean? Well, if we think about physical activity, the World Health Organization will say there's 3 types. There's light, there's moderate, there's vigorous physical activity. And we can, those lines, those dotted lines in terms of the thresholds that demarcate those, we can use lots of different metrics to cut those through. One of the simplest is just effort level, right? So again, as all of you are sitting here right now, your effort level is 1, right? That's the lowest. So on a 10-point scale, sitting quietly at rest is a 1. If the fire alarm goes off, we got to hustle out of here as fast as we can, or sprint to save your child from an oncoming car. Get out of the way, danger pace is a 10. So the range there in terms of effort level for anyone is 0 to 10, right? So moderate physical activity is about a 5. You could carry on a conversation with a workout partner. Vigorous physical activity is about a 7 out of 10, right? So you wouldn't want to have a conversation, but you could still spit out a couple of words. I'm going to talk about vigorous physical activity in this yellow range. So we're talking about effort levels of about 7 or 8. Your heart rate's around about 80% of its maximum. I'm not talking about all out or as hard as you can go exercise here. And this type of range is very scalable to many different individuals. And so to make that point, I'm going to show this. This is actual heart rate tracings from 2 different individuals on very different ends of the fitness spectrum. Top tracing is from an Olympic athlete. Bottom tracing from a person who has coronary heart disease. The Olympic athlete is older, much better shape, of course. The speed they can run much, much higher. But they're both doing the exact same workout. 4 4-minute bouts of vigorous physical activity at about 90% of their maximal heart rate. But it's highly individualized. So it's just a striking example of the scalability of vigorous physical activity. It's what's vigorous for you. And so the takeaway is intensity's relative, and everyone needs to be tailored individually. So what is vigorous for you? And it can be widely scaled. So the question that we've been asking in our laboratory, what's driving our work, is what about brief, vigorous, intermittent physical activity or structured exercise? Is this viable? Is it viable in all respects? First of all, does it move the needle in terms of these biological metrics? Does it improve fitness level? But also, will people do it? We're working with exercise behavior specialists to see if people will engage and follow this type of pattern. But it looks like this: relatively short total amount of physical activity, but you're briefly getting into those vigorous ranges, but you're taking a break in between. And so the type of workout, if you will, that I'm talking here, a few brief hard efforts, low total time commitment. So about 5 minutes of vigorous physical activity in a session that lasts less than 15 minutes or so. And so I'm going to, as we look to wrap up here over the next 5 minutes, show you 2 types of evidence to support that this can be beneficial. We've been doing some simple studies around brief stair climbing, Even if you're relatively in shape, hustling up a few flights of stairs can make you huff and puff a little bit. And we've asked the question then, people don't have to do this on a bike. If they work in an office tower or, at home, go up and down the stairs a little bit. We did this work in the business building at McMaster. 3 20-second bursts of hard stair climbing 3 times a week for 6 weeks. These are small studies, proof of concept studies in groups of 10, 20 individuals or so. And so we didn't say sprint up the stairs like you're saving your life or running from a fire. Climb the stairs as quickly and as safely as possible, taking one step at a time. These are the heart rate tracings for individuals. So over the 10-minute period, you can see your heart rate gets up into that vigorous range, starts to come down in recovery, and it goes up again. And it didn't matter if you're doing this stair climbing or cycling. The mode of physical activity doesn't matter. There's no best exercise in order to elicit these effects. But on average, we got into that vigorous range, we measured that, and then over the 10 minutes or so, their average heart rate was about 8%. What did it mean in terms of their fitness? A 1 MET change in their cardiorespiratory fitness, which is exactly what's we recommended we should do. So the evidence that 6 weeks can move the needle on average by about a MET. You can do it with 6 weeks of vigorous stair climbing exercise, total of 10 minutes a day, 3 times a week. There's the number for cycling. So the mode of exercise doesn't matter. You like elliptical exercise, that's fine. You like ballroom dancing, that's great. Pick your activity, doesn't have to be structured exercise. Use it to get into the vigorous range. So again, small proof of concept studies. We're now starting to see randomized controlled trials in other groups of individuals, not just young healthy students, taking this approach. So I'll give you one example. This is a study that was looking at people who are obese and have metabolic syndrome. Over 100 people randomized to now 3 months, 12 weeks, only twice a week, interval exercise or no exercise. The protocol, a 2-minute warm-up, 5 1-minute efforts with a minute of recovery at a relatively high or a moderate intensity and a short cool down. There's the change in their fitness. The high intensity group, a 1 MET change in 12 weeks. The moderate group, you don't want to do vigorous, that's okay, right? You'll still see an improvement, it just won't be as great as you see with vigorous physical activity. No change in the group that didn't exercise, not surprisingly. They also measured metabolic syndrome scores, those ran in the opposite direction. So in a dose response, as your fitness got better, your metabolic syndrome scores improved as well. So you add up the deleterious scores, those numbers go down. The takeaway, less than 30 minutes, same as what we showed in our study, can really induce clinically relevant changes. That's 30 minutes versus 150 minutes as we're being recommended now. Where is our current approach? This is some research that we're collaborating with colleagues at the University of British Columbia. We have several randomized clinical trials ongoing looking at people with obesity, people with type 2 diabetes, asking this question. What about brief isolated bouts of hard exercise that you do sporadically throughout the day? So rather than this approach, can't do that, okay, we'll meet you where you are. What about this? Right, so as you were coming to the Globe today, maybe you got off on the 14th floor and you ascended the stairs to the 17th floor. Right, after this lunch right now, no one's gonna do it, I know, but you do a series of air squats, right, in between, during the break. This is what we're talking about. Simple exercises, bodyweight style exercises that you can do very easily. You could use equipment if you want. We're asking a question, does that move the needle? This work is ongoing, but it's complemented. We heard earlier about epidemiological work. This is some epidemiological work. So this is some work that I was involved with, published in Nature Medicine 2 years ago, led by a colleague in Australia. We're asking the question, this is not structured exercise, just what we need, another acronym. VILPA is just brief bouts, vigorous physical activity of a lifestyle nature. So you're not planned and structured exercise, but just as you're going about the day, we heard that example earlier, just going for a walk with the dog. Okay, next few trees, next few light posts, I'm picking up the pace into the vigorous range. That's what we're talking about. So we use accelerometers to track behavior in individuals, and that's showing over the course of a 24-hour day, most of us are very sedentary, our expenditures are low, but periodically if we get into that vigorous range, if you're leaving here and you're going to Union Station, right? You got a backpack? Carry it briskly to Union Station, get into the vigorous range. Playing with your kids at night, play vigorously for a minute or two with them. Does that move the needle in terms of fitness? And so we looked at 25,000 individuals who self-identified as non-exercisers, right? So they were just engaging in vigorous physical activity throughout the day. These are the hazard scores. So the lowering of their risk of dying expressed relative to duration in minutes per day of vigorous physical activity. That's 4.5 minutes. That's a 25% reduction. And so the takeaway was 4.5 minutes a day of lifestyle vigorous physical activity, a 25% reduction in all-cause and cancer mortality, and a larger reduction in cardiovascular disease mortality with 4 to 5 minutes a day of vigorous physical activity. This isn't in the guidelines yet, but hopefully it's coming. This is a commentary earlier this year in Nature talking about these small doses of physical activity and pointing out that they can be good medicine. Small doses of activity should be added to future guidelines, but you don't have to wait for that. So while we're waiting for that to happen, clinicians, you individually, can take advantage of that new knowledge now. Thank you for your time, and I hope you enjoy the rest of the day.
Dreaming of a healthy future? A longer, better life is possible by making small, healthier choices every day and then making those habits stick. Here's how you do it. Rather than setting one giant goal like climbing a mountain, experts suggest starting with smaller, achievable activities that fit into your lifestyle. A health assessment can help you level set and get on the right track. Start with one small change that you think you can stick to, like biking to work one day a week or swapping a soda for sparkling water. Small tweaks create what experts call positive habit loops, making it easier to add more healthy habits as you go. Did you know dancing counts as cardio and may reduce the risk of dementia? Petting puppies can improve mental wellness. Doodling can be meditative. Experts suggest finding something fun and making prevention a joy. Whether you partner with friends or coworkers, use an app to track and log your progress. Work with a dietitian, trainer, or coach, which may be covered by your benefits plan. Experts say having support systems like these can provide the motivation and accountability you need. When you're feeling stuck, think of the future life you want. Every healthy change you make is an investment in that future.
Hello, everybody. Welcome back. I'll just give a minute for everybody to take their seats. Hello, everyone. My name is Caroline Alfonso, and I am the health editor here at the Globe and Mail. So we spent our sessions earlier today looking at the demographic trends impacting health in Canada and the tangible benefits of exercise. We're going to spend the rest of the afternoon focusing on some other levers that impact health and longevity. In our next conversation, we will be focused on preserving mental health and the strategies and tools people can use to strengthen resilience and their well-being. So please join me in welcoming to the stage registered physiotherapist Anita Osuru, registered physiotherapist Jean Tsai. Psychiatrist and assistant professor in adult psychiatry and health systems at the University of Toronto, Minna Hussain. Welcome, everyone. Thank you for joining me today. I thought we should get started by everyone just telling us a little bit about themselves and as it relates to today's topic. Would you like to start, Anita?
It's an honor to be here with you today. My name is Anita Owusu. I'm a MSW, RSW psychotherapist. And part of my mission is to support individuals to reach their ideal emotional state. This isn't to say that they'll always be happy, but having the ability to feel confident to get through whatever hardship, because life promises that. And I believe that without our mental health, we have nothing. You could essentially lose a limb, but if you have a strong mindset, you can get through that. And what I love about being in this position is that it definitely motivates and encourages and inspires me to practice what I preach. And my goal is to live a long, healthy, and happy life.
Thank you. Jean?
Hi, everybody. Lovely to meet you all. I'm Jean Tsai. I'm a registered psychotherapist, and I have a practice that's based in downtown Toronto here. I also work at a counseling center at a post-secondary setting, so I see a lot of students, young adults, I support international students, and an area that I'm very interested in is supporting folks who have experienced really difficult experiences in their lives, and communities whose lives have been impacted by trauma and violence. So looking forward to the conversation today. Thank you.
Hi, Minna.
Hi. So I'm Minna Hussain. I am a psychiatrist here in Toronto. I work in inpatient psychiatry predominantly, and also run an outpatient clinic and work in the emergency department. So I see a range of mental health difficulties, from the most severe, which is things like schizophrenia, bipolar disorder, suicidality, to more common things like depression, anxiety of lower scales as well. Outside of my clinical work, I am involved in research, and my area is global mental health, with a particular interest in women's health and maternal mental health, and now more broadly, parenting. And outside of that, I'm also involved in the creative arts. So I am a film producer and have produced films around mental health with the aim of reducing stigma and bringing very challenging topics to the forefront of conversation. So I'm excited about today's discussion as well.
Great. I think I'd like to start the conversation by outlining some of the issues you're seeing and then some of the solutions that you have for our audience. So, generally speaking, Anita, what have you been seeing in your practice, especially after the height of the pandemic?
So during the pandemic, there was a huge surge in anxiety and depression. But what I'm actually finding now in particular is that there's a lot more anxiety. Often where anxiety is, depression follows. But people are struggling to get back to the hustle and bustle of life, navigating relationships that may have been strained during the pandemic. There's a lot of social anxiety as well, just getting out of the house and having to return back to work and engage in the very same way.
Yeah, definitely echoing Anita there. In my private practice, I support a lot of folks who are in a helping profession and in healthcare, so nurses, teachers, and people. I'm seeing a lot of burnout. People who have, kind of really worked hard to pull through the years of the pandemic and then are sort of now beginning to really need some respite, particularly caregivers, parents of young children. So seeing that a lot. In terms of the young adults and students that I support, really seeing the social anxiety and people having a hard time forming meaningful relationships that are so needed at this time in their lives. And then just such struggle to balance the pressures of, financial stress, increased costs of living, and so really not having time for things outside of, work, school. So, and then one last piece I'll share is we're also seeing an increase of diagnoses of ADHD, autism spectrum disorder, so lots of young adults going through that as well. I don't know, Minna, I've just passed to you.
Yeah, thanks. Echoing both of your responses as well. So it's been a few years since the height of the pandemic and since the lockdown, which now feels a bit of a distant memory, thankfully. Around that time, I was in England doing my residency, and what we saw was a lot of people were not able to access the services. So there was a lot of people who were delayed in receiving treatment. And what I was seeing in my practice at that time was the acuity was extremely high. So people were in crisis by the time they got help. What we're seeing now is kind of the aftermath of all the changes that have happened due to the lockdown, due to the social impacts, things like, there's a huge cultural shift. Virtual working is a big part of our lives now. We saw a lot of domestic violence, relationships that had broken down during the lockdowns. So we are seeing much more anxiety, depression at the moment, lots of substance use. That's a big thing we're seeing right now. And of course, things like the cost of living, those stressors remain at the moment. So we're seeing the effects of that.
Minna, so what are you're seeing a lot of different things play out in your practice. And I'm wondering what steps that what advice are you giving as far as steps that people can take to deal with these stressors?
Very good question. So I would say that so first and foremost is that if there's any risk to anybody's safety, what I would advise, beyond the day-to-day of managing your stresses would be to get yourself to a place of safety. So if people are having thoughts to hurt themselves or to end their lives or to hurt anybody else, which can happen as well, the first step would be to get yourself to a safe place, which is like the emergency departments, which are open 24 hours, police, all of that kind of stuff is available and is more common than we think to be going through these crises. The next steps, which is more practical things that people can do on a day-to-day basis, there's so many different tips that I'm sure my colleagues over here will talk about as well. But one of the effective things that I talk about to my patients and my clients would be things like introducing structure to your day. I personally do that and advise people to do that through a morning walk. That's something that's been really helpful. There's lots of different benefits from that. You get moving. I know the talk about that before this was about movement, getting out in nature, having structure to your day, which is a human need. We know that people benefit from having that kind of structure. Also, of course, getting outside, the social aspects of that.
It's amazing to think that those simple things like taking a walk, we forget how that would help sort of relieve some of those stressors in your life.
For sure.
You mentioned that you deal with some healthcare practitioners in your practice, and they've dealt with a lot of these stressors as well. What sort of advice are you giving them, and what steps are you advising them to take there?
Yeah, so there's a couple of things. The first piece is around the stance towards self-care. And I know it's a word that sometimes can be used quite a bit, and people can have different reactions to that. And the stance around it being something much like, I believe it was Martin, I came in around your talk, sort of the exercise snacks, much like that. It cannot be the kind of thing that you do, I'll just wait until such and such a time to do this or to enjoy this or to care for myself. Or I appreciate, especially working with people who care for others, that we do that on a day in and day out basis, and then we do it in our homes, in our community. So absolutely, there are lots of times when we do have to set our own needs in a particular place and tend to them at a later time, but not, don't wait till the summer. And lots of things in nature teach us that, if a place loses water for too long, the amount of energy and resources it takes to restore that is huge. It's a lot more than if you're able to tend to that in a consistent way. So that's the first piece. Second piece, it's really important, building off of Minna's, to have a physical practice when our nervous systems are out of balance and we're in a particular sort of stress response. We can't think our way out of that. We can try, but we can't. And we do have to return to the body and cultivate practices that speak to you. They don't have to look the same as everybody else's. But those squats looked pretty great, and the stairs, like whatever is available. We work with what we have. So those are two pieces I wish to offer.
Anita, what are you advising your patients?
To piggyback on what Jane and Minna said, so it's the thing fuel. So when you think about fuel for the body, you need sleep. Sleep regulates our mood. Nutrition obviously re-energizes us. What I find when I'm particularly stressed is that I crave a lot of sugar, because I love sugar, and carbs, and that's because it helps boost serotonin. So your body is trying to find anything that will help you. But the more that you sort of, intake those sort of unhealthy nutrition, it has the adverse effect. And last but not least, exercise. It helps re-energize us. And what's interesting is that those are often the first things to go when we are feeling stressed. And so I often encourage my clients to ensure that during times of calm, to build these practices, because what we practice grows stronger. So you already have sort of, something to just fall back on without having to think. The other thing that I'm an advocate of is the supply and demand idea. So the level of stress should match the level or the tools that you have. Yeah. So, during times of mild stress, taking a deep breath might be helpful, but when it's a little bit more acute or intense, you kind of have to draw on all the things, and similar to Jean, mindfulness, just things that help us to really regulate, and our nervous system plays a huge role when we're struggling, so.
That's a good point, and also a good point not to eat a cookie on my way out. Minna, you touched on families and stresses, and one of the things that as we came out of the height of the pandemic, again, we saw a lot of children and families dealing with mental health issues, particularly because many children were off school, they were not with their friends during the lockdown period. And as we sort of come out of it, I'm wondering what advice you have for families and children to sort of deal with or help with their mental health issues, to deal with some of the stresses that they currently face.
Again, a very good question. I think it's a very difficult time to be young and to be growing up. I was watching that, I don't know if anyone's seen it, the Netflix show Adolescence. Is it called Adolescence?
It is.
I think so, yeah.
That's right.
And just the impact of social media, that child came from what looked like a pretty stable environment, but was struggling with his mental health. And there's all sorts of different messages that are being given to children. There's, their self-esteem is it seems at higher risk than it ever was. Bullying can be on, through very vicious ways and on a very large scale as well. What I would suggest, of course, nobody knows the answer to this at the moment. Social media, there are benefits as well, but it would be to create a very safe and open environment for your children. We tell our parents who are patient sometimes to certain ways to be emotionally open in front of their children. So things like in an, obviously like an age appropriate way, but to be able to express your emotions so that your child is able to do the same thing back to you. So a very safe environment. If you feel angry, you are able to show that to your child, but manage it in a certain way. When they start to have difficulties regulating their emotions, allow them to feel those emotions, but also give them techniques in terms of how to tell them that those feelings are normal, but how to bring them down, how to manage them. Do things that are, some of the advice is very similar to what we give adults and what we talked about. Make sure that your sleep is good for your children. Of course, get outside, go for walks, have those social interactions, and of course, structure and routine to your day.
Yeah. Anita, do you have anything to add to that?
Sure. Too much, actually. I would say, similar to Mina said, creating an open door policy where true conversations can be had, and if it's difficult, connect them with people in the community who they trust to do so, because it's not always easy to go to a parent. And if it persists, then you get them the support that they need. But, a very important point, not that anyone is asking for parenting advice, is that we live in a digital age, and our capacity or attention span has decreased so much that we can't tolerate anything that kind of sets us off. Even as adults, we struggle with that. So I see that a lot in children. And this is corroborated by Jonathan Hyatt's research, in that there was an increase of, hospital visits has increased by 90% for young boys with suicidal ideation or attempts, 150 increase just among youth in terms of anxiety and depression, and 188 of self-harm for young girls. So they're just something that's happening in our society. So I think it's really important to be attentive to those things. Because bullying used to be, limited to the school space, but now it just lives on, and there's no end. So
Yeah. Jean, what do you tell your families that, where children are dealing with mental health stress issues, and how do they cope with it?
Well, I first start with a lot of humility because I am not a parent. And there's just so much parents have to balance, and all of what Mina and Anita have noted are such important and vital practices, and they require bandwidth. And so what I really try and work with students and parents and clients to do is really protect that bandwidth. When we're approaching burnout, our assessment of how much we can take on actually can be quite skewed. And a lot of times we end up taking on more when we're kind of in that place, because our fight kind of response is quite activated, and we're wanting to do stuff, we're wanting to help. And that can come a little bit more from that ungrounded place. So I would say setting aside our devices. I know it's very hard, but if we can train ourselves into this level of dependence with it, we can practice ourselves out of it as well. And it's so important because even if let's say you take in some of the information and you noted, okay, this is something I'll tend to later, our minds have a way of like hanging on to that. And it's like a CPU, right? Like background program kind of running. When you set something aside, really set it aside, and that'll free up more room inside for you to be present with your kiddos, with people you care about. So that's one piece. I myself struggle, but it's not about perfection. It's about keeping it up and trying. Yeah.
Thank you. You've all shared some great techniques, but I want to put you on the spot a little bit and ask you about one technique that you would suggest for people to handle their stress. Anita, do you have a technique that you would recommend?
Yes. So one thing that I tend to do often with my clients is grounding exercises, just visualization, sort of exercises to help bring your body down, because stress is synonymous with tension, overwhelm, all those things. So anything that opposes that is what, right? We need those moments of calm and ease to remind ourselves of what we're capable of. There's a saying that anxiety is the overestimation of danger and underestimation of coping skills. So it's particularly important to remind yourself that, these things will pass and you have the capacity to be able to get through it.
Jean?
So I tend to go for things that we have to do every day, every moment. Again, kind of really vibing with Martin's talk. But, things, it's so much harder to, I'm going to attend a, hour-long sort of session, although we're so appreciative that you all are here, that you've made the time to be here and not somewhere else. But any practices that people can kind of build in, even if I just invite you right now, to take a moment to use 30% of your attention to just check in on your breath. Just even that automatic kind of noticing can kind of slow that down, or at least just bring some kind and caring attention to it. You can do it when you're in the commute, when you're doing dishes. If we have to breathe every moment, let that be the practice. That can be challenging for some folks who have experienced trauma and various other kinds of things that can make that challenging. So other forms that help people get into their body. Sometimes just thinking about the breath really irritates some of my students. They're like, what are you talking about? So pairing it with a visual, or, if you are able to have your feet on the ground when you're breathing out, pairing it with a little bit of pressure in your big toes, kind of feeling that. So anything to sort of help us anchor a little bit into the present moment. Yeah.
Thank you. Minna, what is one technique you would recommend to manage stress?
So those are
Those are great.
effective techniques. One of the ones I find very effective, which I don't always have the self-discipline to do, is journaling and writing in general. Again, we talked about the digital age. That's something that's almost, not that many people put pen to paper anymore. It can be as effective it can also be effective if you're typing on your phone, but I think sometimes putting your phone aside and writing things down. So if you're feeling stressed about something, writing down why you're stressed about that. The worst possible outcome, sometimes you can write that down and challenge your mind that way. I find that an effective technique, and of course everything around mindfulness and meditation, bringing yourself into the moment, all of those are very effective techniques to make yourself feel a little bit more grounded.
And therapy is also an avenue for dealing with some of these stressors. And I wanted to talk to you about that aspect of things and what should people expect from therapy. Do you want to start, Minna? What are the expectations there? What can they do to maximize that experience as well?
I'm actually, because I'm a physician, I'm going to hand this over to my colleagues who are probably going to be able to speak to this.
Anita, would you like to?
Yeah. So I always, I will encourage people to come to therapy with a goal. I think sometimes when people come into therapy, they think that it's a venting session. And while it's important to have a sounding board, therapy often fails when that's the purpose that it serves. Because you can talk to your friends and your family for free, right? So it should definitely be more purpose than that. I also say that there's no growth without challenge. Mm-hmm. So while it's important to have, someone supporting you and validating how you're feeling, we're not always right. And sometimes, as a result of our trauma, we behave in the same way that our perpetrators do, right? So it's just being open to being challenged so that you can grow emotionally.
Yeah, one thing I like to offer is that there are almost as many types of therapists and therapy approaches as there are people. So it's useful to find something that matches or resonates with what feels like a right fit. And a lot of times it can be more of a gut feeling, kind of a chemistry or just how you might feel in somebody's presence. Of course, training and certain areas of expertise, of course that matters. So there's that piece. It can also take some time for things to start to feel helpful or to have a little bit more traction. And it can take some time, too, to build up that trust. So I will encourage folks to take a bit of time. It can take a couple of sessions for that to start feeling more comfortable. And, even for myself, as a trained mental health professional, in my own experiences of accessing therapy, it's even though I sort of, I know how it works and how to really get the maximal kind of benefits, but it's not always easy. And so I think kind of giving a little bit of time and space to kind of grow and set is useful. And then a lot of the work happens in between sessions. Yeah, because people are in our offices for 50 minutes, 60 minutes, once a week or once every 2 weeks. And the rest, is putting things into practice and working on things. So that's really important.
Great. We have a couple of minutes, so I'm just going to open it up to the audience if anybody has a question. No? Well, I have a question. Oh, someone does. Yes? Go ahead.
On the topic of therapy, there's a lot of chats around like AI. I know Pi specifically was one when they were first coming out. From a technology perspective, any views on that? Can you repeat the question?
There was a question about AI and the role of AI in
There's
therapy.
a microphone coming to you.
Hi, sorry. Just to repeat the question, it was around when all the artificial intelligence and language models were coming out. There was one called Pi, specifically Pi, that was meant to be a little bit more mental health focused and stuff. So I'm sure things have come a long way. I was just wondering, on the topic of therapy, any views on AI and using that maybe as a starting point, or maybe not at all?
How much time do we have?
You have seconds, Anita.
I'm an advocate for human connection, especially when it comes to these things. And, they say trauma that happens in relationships, it takes relationships to heal them. I'll be curious to see where it lands. I'm sure it can be helpful for some people. But for me, this is where I stand right now.
Would you like to add anybody else? No? Well, that is all the time we have, unfortunately.
I guess we're not that progressive.
Thank you, Anita. Thank you, Jean. And thank you, Mena, for taking the time today to join us. Really appreciate the time and the advice that you shared with our audience. Thank you. Thank you. I'm very excited to introduce our next presenter. Leslie Beck is a registered dietitian and is the director of food and nutrition at MedCan. She is also a longtime contributor for the Globe and Mail. You can read her today online. Her weekly column, Food for Thought, is a favorite among Globe and Mail readers. Leslie is also a best-selling author. She's written 12 books on health and nutrition. Today, Leslie will be sharing her insights on how shifting your eating habits can lead to a stronger, healthier life. Please welcome to the stage, Leslie Beck.
Thank you. Okay. Thank you so much. You too. Thank you. Hello, everyone that's here and everyone that's tuning in virtually today. It's great to be here. Thank you very much to Manulife for sponsoring this event. And thank you very much to the Globe and Mail for inviting me to present today about the very important role that diet plays in healthy aging and extending the amount of time where we live in good health. I'm very grateful to be able to provide evidence-based information to Canadians about diet and health. I mean, I can't believe I've been doing it at the Globe and Mail for 21 years now. It seems a little shocking to me, but I love doing it and I'm very happy to do it. There's no question, though, that longevity is becoming increasingly popular today. We see it's a huge topic of interest. It's a growing business. Longevity research is booming as well. People want to live longer and healthier lives. So what I'm gonna share with you, what I'm going to be speaking to you about today. And really my main goal is that I'm going to be providing you with some takeaways that you can go home and implement in your own personal diet and your family's diet as well. So I'm going to discuss the concept of diet quality. I also want to share with you why your overall dietary pattern is the most important thing when it comes to health and longevity versus following a specific diet per se. Talk a little bit about optimal dietary patterns for longevity, the research around that. And you'll see that there's many ways to eat well for longevity. And we'll talk about different patterns and what are some of the key food components to be thinking about. And then I'm going to give you all an opportunity to score your own diet if you like. So we'll look at a certain method to do that and to see how well your diet qualifies you for healthy aging. And then I'll end off with very briefly just talking about the importance of preserving muscle mass and muscle strength as you age, and I'll provide some dietary strategies to do so. Okay, so let's get right to it. So diet quality is a leading predictor of chronic disease risk and premature death. In fact, diet is considered the leading behavioral risk factor for chronic disease risk and early death worldwide. Diet quality is something that can be measured in many different ways. But diet quality is the extent to which your diet adheres to dietary guidelines that promote health. So I would also argue that diet quality should be considered a vital sign as well. So when we talk about high quality foods, obviously we're talking about unrefined and minimally processed foods, fruits, vegetables, whole grains, nuts, beans, and lentils, healthy sources of protein, healthy plant-based fats, and lower quality foods we're referring to. They may be low in vitamins and minerals, often high in calories, high in added sugars, sodium and unhealthy fats, and highly processed as well. So what exactly is a high quality diet? It is not the fact that you might be following a low carb diet or avoiding sugar or avoiding fats, for example. Diet quality is all about your overall dietary pattern. It's the quality, the quantity, the variety, and the combinations of foods you eat on a regular basis that matters most when it comes to health and longevity. We know that the foods and the nutrients and all those protective plant chemicals in our diet, in a varied diet, they work synergistically to exert their health benefits. And that's why now research has shifted to focusing on dietary patterns to capture that complexity of our diet. And studying dietary patterns, researchers capture the complexity, and we know that dietary patterns are much more closely aligned, associated with overall health and disease risk than individual foods or individual nutrients. So I argue here that there are no such thing as superfoods. I've always said that. Superfoods, I don't even like that word. But instead of focusing on a few foods that may be incredibly nutritious, focus on your whole plate, focus on your whole diet instead. Okay, there is convincing evidence from both randomized controlled trials and observational studies that eating a high-quality diet reduces the risk of many chronic diseases and early mortality. The latest study, which you may have read about, was published last month in the journal Nature Medicine. And for this study, Harvard researchers, as well as researchers from the University of Montreal and the University of Copenhagen, they set out to understand what is the relationship between long-term adherence to healthy dietary patterns during midlife, so your 40s, your 50s, and your 60s, and healthy aging. And to do this, they analyzed data from 105,000 healthy adults, They were healthy at the beginning of the study, and these participants were followed for 30 years. And the researchers defined healthy aging as living to the age of 70 free of 11 major chronic diseases, but also without any impairment in cognitive function, physical and function, or mental health. And researchers, what they really did was they assessed how closely people's diets matched 8 different dietary patterns, including the Mediterranean diet, the DASH diet, the MIND diet, an anti-inflammatory index, plant-based eating patterns. And we'll get into a few of those a little later on. And they did this by collecting lifestyle data, health data every 2 years during the 30-year follow-up. And every 4 years, they measured participants' diets. So what did they find? After 30 years, only 9% of participants achieved healthy aging, only 9%. And higher adherence they found to any of the 8 dietary patterns was associated with a greater chance of becoming a healthy ager over the 30-year study. However, they found that close adherence to a pattern called the Alternate Healthy Eating Index had the strongest protective effect. And even when, well, actually, I'll give you, oh, did I run? That slide is different than that slide. That's interesting. Okay. Anyway, participants who followed this pattern were 83% more likely to become a healthy ager compared to people whose diets really didn't match up with this index. And that was also true when the age threshold for healthy aging, when they changed it to 75, they also found that the Alternative Healthy Eating Index score was had the strongest effect. So again, those participants whose diets closely matched this index were 2.24 times more likely to be a healthy ager at age 75 compared to those who didn't follow it. Okay, so the takeaway here is that there are multiple ways to eat well for longevity, for healthy aging. There's no single healthy dietary pattern. And while all of these patterns, they had differences for sure, but they all had common components. And they all prioritized whole fruit, vegetables, whole grains, nuts, all the things we've been talking about, beans, chickpeas, lentils, while at the same time limiting red and processed meat, added sugar, and added sodium. So I really do believe from all the research, the key strategy to really trying to adopt a healthy aging diet, the key is really to be focusing on increasing your intake of whole plant foods. So let's get into some of these dietary patterns. I just want to share with you, won't be talking about all of them that were covered in the study, but a handful of them. And what are the food components? What are the main components? So the Mediterranean diet, I'm sure we're all very familiar with that. It is considered the gold standard dietary pattern because of the numerous health benefits that have been associated with it. It is a very plant-forward diet, so daily foods are, fruits and vegetables, beans, nuts, whole grains. When it comes to dairy products, cheese and yogurt are consumed daily in low to moderate amounts. Fish and poultry are included a few times a week, again in low to moderate amounts. Red meat is eaten less than 3 times a week, and when it is, it's consumed in very small portions. Sweets are considered treats and included in the diet very occasionally. Of course, we know the principal fat in the diet is extra virgin olive oil, rich in anti-inflammatory monounsaturated fat and protective phytochemicals as well. And wine is consumed low to moderate amounts, but typically with meals. The DASH diet, are many of you familiar with the DASH diet? No, some? Okay. So the DASH stands for Dietary Approaches to Stop Hypertension, and it became famous for the first time in 1997 when a randomized controlled trial was published in the New England Journal of Medicine, proving that following this pattern substantially lowered blood pressure in people with mild to moderate hypertension, even in the absence of any weight loss. And since then, it's been widely studied. It has many health benefits are associated with it beyond lowering blood pressure. But it certainly is the go-to eating pattern to lower high blood pressure. The hallmark foods in this diet are considered fruits and vegetables. They're eaten daily, plenty of them. Beans, lentils, and nuts, depending on your calorie needs, anywhere to 4 to 5 servings per week. And then low-fat dairy products, 2 to 3 servings per day. These particular foods supply a good amount of calcium, magnesium, and potassium, which are minerals that are very important for regulating blood pressure. Of course, the diet emphasizes whole grains over refined grains. It's low in saturated or animal fat and lower in sodium, generally 1,500 to 2,000 milligrams a day. Okay. What about the MIND diet? People familiar with the MIND diet? A little bit? Okay. So the MIND diet, that stands for Mediterranean Intervention for Neurological Delay. This diet really became known in 2015 when the first 2 studies were published, and these studies were conducted in about 1,000 older adults living in the community, and they wanted to see how their diets matched up with the MIND diet. And they found that those whose diets were compared very well to the MIND diet, that was associated with a lower risk of cognitive decline in one study, and another in a lower risk of developing Alzheimer's disease over the 3-year period. And I will say that even just moderately following the MIND diet was associated with protection from Alzheimer's disease. So it doesn't have to be perfect, that's for sure. So this is a blend. It's got elements of the Mediterranean and elements of the DASH diet, but importantly, it also includes very specific foods and nutrients that have brain health benefits that have been shown in previous studies. So this particular dietary pattern gives recommendations for intake, weekly, daily, portion sizes, for 9 brain healthy food groups, and you see them there. Berries, for example, it's recommended that we eat berries at least 5 times a week. A portion size is half a cup. Berries are very high in potent anti-inflammatory compounds called polyphenols. Leafy greens are recommended every single day. Spinach, kale, Swiss chard, arugula, even romaine lettuce counts. And these greens are very high in lutein and beta-carotene, especially lutein, which is very good for brain health. And then you'll see the other foods there, many of them similar to other dietary patterns. Olive oil, of course, is the main fat. 2 tablespoons per day is recommended. Recommendations are also given to limit the intake of 5 brain unhealthy food groups, which you see there: sweets, butter, hard margarine, fried and fast foods, red and processed meats, and full fat cheese. So now I'll talk a little bit about what you may not be as familiar with is the alternate healthy eating index, which we just covered in talking about the newest study. So this is a point-based diet scoring system, and it was developed by Harvard researchers. This is a dietary pattern that how it's different than other scoring systems is that it includes foods and nutrients that are very strongly tied to chronic disease risk, whether good or bad. A higher score obviously indicates a healthier diet, and a higher score is also associated with living a longer and healthy life. And not just the study I mentioned earlier, but other studies too have associated this pattern of eating with longevity. So let's take a look and figure out what your score is. A little bit of mental arithmetic. And again, you know what? Scoring your diet, it's not practical to score your own diet. But I'm going to show you what the components of this index are. And I think even just doing so, it gives you a little bit of understanding perhaps where there's areas in your diet that you may want to improve. So vegetables. The ideal intake is 5 servings a day. You get 10 points if you eat 5 servings a day. That's the highest score you can get per category. So a serving is a cup of lettuce, a cup of salad greens, or half a cup of cooked vegetables. Potatoes don't count. And you score 2 points for every serving you eat each day. So you can think about that. And what you can also do, if you're so inclined, is you could do this, because days differ, right? Days will differ. But you could do this for a week and then get the average to get your average daily score. This is why these food groups I've shown you, the greater consumption of vegetables is associated with a lower risk of cardiovascular disease, certain cancers. Leafy greens, as I mentioned, may guard against Alzheimer's disease, and type 2 diabetes as well. Okay, so let's move on to fruit. Whole fruit. 4 servings a day is considered optimal, ideal, and you get 10 points if you eat 4 fruit servings a day, which is considered 1 whole fruit or half a cup of berries, half a cup of cut up fruit. So score 2.5 points for every serving you eat per day. So that's where you get your points. And again, if you want a copy of this presentation, I'm happy to supply it as well. Okay. Whole grains, 5 servings a day is recommended, 10 points, that's considered ideal. And a serving would be half a cup of cooked whole grain, be it brown rice, quinoa, whole wheat pasta, or a slice of whole grain bread, for example. So 2 points for every serving of whole grain you eat during the day. If you have 1 cup of cooked oatmeal, for example, in the morning, you've got 2 servings right there. Okay. Soy, beans, lentils, and nuts. If you eat at least 1 serving daily, you get 10 points automatically. And if you don't eat any of these foods daily, then you get 0 points. And a serving size isn't that much. It's only half a cup of beans or chickpeas. It's a 1/4 cup of nuts, a tablespoon of peanut or almond butter, or about 100 grams, 2/3 of a cup or so of tofu. Okay. And we know that soy, beans and lentils, nuts, they're tied to a lower risk of cardiovascular disease, and greater consumption of nuts is also associated with a lower risk of type 2 diabetes and a lower risk of weight gain over time as well. Red and processed meats, lots of talk about them, but so if you don't eat any of these things, period, you get 10 points automatically. If you eat, and let me tell you what a serving is. A serving is 4 ounces, a little bit bigger than the size of a deck of cards, of cooked red meat, or 1.5 ounces of processed meat. So if you eat 3 to 4 servings a week, you get 7 points, and that would be 12 to 16 ounces of cooked red meat, or up to 6 ounces of processed meat. And if you eat, that's per week, yes. If you eat at least 1.5 or more servings a day, each day you get 0 points. So that means you'd be eating 6 ounces of red meat every day, or 2.25 ounces of processed red meat. Okay. Fatty fish, this is a measure of your omega-3 fatty acid intake. So if you eat a serving is 4 ounces of cooked oily fish, salmon, trout, Arctic char, sardines, mackerel, herring. If you eat 2 servings a week, so 8 ounces a week, you get 10 points. If you only have 1 4-ounce serving of fish a week, you'll get 5 points. And if you don't eat any fish at all, oily fish per week, you get 0 points. Okay. And then we'll move on to sugar-sweetened beverages and fruit juices in this category as well. Even though it's naturally occurring sugar, it's a concentrated source of sugar. So if you don't drink any of these things on it, you get 10 points. If you have 1 serving or more a day, 0. Okay. So for those of you who are taking pictures, if you're going to do this at home, I just want to interpret a little bit what the scores mean. So the maximum score is 110 points. And if a score of 56% or higher indicates a healthy diet, a score of 20 points or fewer is an unhealthy diet. And just to bring it back to that study I talked to you about, the healthy agers, when they followed this particular dietary pattern was more protective for healthy aging among the 8 studied. The average healthy eating index score for the healthy agers was 68 for women and 70 for men. Okay. All right. Okay. All right. So now we'll just move a little bit on to preserving muscle mass with muscle mass and muscle strength into older age. I think we're well aware that a high quality diet pattern is associated with guards against chronic disease and premature death. But it's lesser known that eating a healthy, high quality diet in midlife can help preserve muscle mass and muscle strength, muscle function into older age. And that's really important because a loss of both can lead to sarcopenia, a skeletal muscle disorder that is defined by a progressive loss of muscle mass, muscle strength, and muscle function. And symptoms of sarcopenia include a slower walking speed, difficulty climbing stairs, more trouble with just performing daily physical activities, and it certainly is associated with an increased risk of falls and fracture, frailty, hospitalization, and complications around surgeries as well. Okay, so here are some of the risk factors for sarcopenia. Of course, aging is one of them. We know that. Age-related muscle mass actually begins after age 30 and increases after age 60. Muscle function and muscle strength declines more quickly as we get older, but especially at age 75. Other risk factors you see there is not being physically active, eating a poor diet, having inflammation or a chronic disease, a loss of mobility, so you're not using your muscles, hormonal changes. And I will say there that when it comes to physical activity, I'm going to talk about diet in a minute, but the most potent stimulus for muscle protein synthesis is resistance training. And research suggests that when it's done 2 to 3 times a week, that helps to build muscle mass and muscle strength, preserve bone density, and maintain, importantly, independence and vitality as we age. Okay. So there are many different ways that your diet, a healthy diet, can influence the underlying causes of sarcopenia. You'll see there that it's really important in your diet to get adequate calories as well as protein to support muscle building, to support muscle protein synthesis. Anti-inflammatory nutrients and phytochemicals like omega-3s, magnesium, beta-carotene, and so on, they help to combat inflammation in the body, and inflammation plays a role in the development of sarcopenia. Antioxidants in the foods we eat, vitamin C, vitamin E, beta-carotene, lutein, that one for brain health. They defend our cells from free radical damage, and free radicals are molecules that can damage muscle cells. And also eating a healthy diet can really improve the composition of our gut microbiome, all those trillions of microbes that live inside our large intestine. And by doing that, in turn, the gut microbiome can help reduce inflammation. Your gut microbiome plays a role in regulating inflammatory immune compounds in the bloodstream. So think about fiber, prebiotic foods, leafy greens are important for gut health. Polyphenols, those polyphenols that are in berries that protect your brain, your gut microbes also use them as fuel. Okay, so just lastly, perfect timing, a little bit about protein. Because I think we're protein obsessed. Everybody, we want more protein. Protein is absolutely a vital nutrient and is incredibly important for muscle health. But how much do you need? And you may not need as much as you think. So number one consideration, first of all, is age. So we know that older adults, they need to eat more protein than the official daily recommended daily allowance to slow age-related muscle loss. And that's because with age, our muscles become less efficient at turning protein into muscle. So the recommendation is for older adults, 1.2 grams of protein for every kilogram you weigh. Compare that to the official RDA that I was talking about. That's 0.8 grams per kilogram body weight per day. So for someone who weighs 77 kilograms or 170 pounds, that means you need to eat 93 grams of protein every day. Let's say you were doing resistance training to build muscle. Your goal is to build muscle. then you need to be consuming at least 1.6 grams of protein for every kilogram you weigh. So for that same 77 kilogram person, they need to consume an extra 30 grams of protein every day, which is a tiny bit more than 3 ounces of cooked chicken, for example. The other thing to consider is timing when you eat your protein. So research does strongly suggest it's important to divide your protein over the day, over 3 to 4 meals. And to include at least 25 grams of protein at each meal to help increase muscle protein synthesis. So I think most people do pretty good at lunch. They do not pretty good at dinner. In fact, they're probably skewing more of their protein to the end of the day. Where many people I see in practice need to improve is to be really thinking about your breakfast. Are you getting a good 25 grams of protein in? Because there is also some emerging evidence that our bodies, because of our circadian rhythms, our biological clocks, that we may be more efficient at turning muscle protein synthesis in general, early in the day versus late in the day. So think about breakfast. And then lastly, I'll just say think about the type of protein too. No, I'm not talking specifically about muscle health here, but certainly from a longevity standpoint, there have been a number of studies showing that getting more plant protein in midlife, again, 40s, 50s, 60s, versus getting more of your protein from animals is associated with a greater likelihood of healthy aging. And on that note, thank you very much. Okay.
Thank you very much, Leslie. That was terrific. I think my points dropped as soon as you took potatoes off the vegetable list. That concludes our event. I would like to thank everyone in the audience and all our speakers for their insights and the advice that they shared today. On behalf of the Globe and Mail, I'd also like to recognize Manulife for sponsoring today's event. Please enjoy our network reception right outside those doors, and thank you everyone for coming. Have a good day.